and we're hearing all kinds of news about Obamacare and health insurance and how companies are cutting back, companies like McDonald's and Caterpillar, because the system don't work. The system is broken, and nobody's had a solution to fix it. But there's one instead right here now is joining us is George Conley, who has become a very successful businessman through the years in the automobile repair business, and I'll let him tell the story, but that's how he got the idea. There's a book out, it's in paperback, and it's published by Wonders, Wunders, Wonders, Inc., and the name of it is National Health Lottery. My Simple Health Insurance Plan presents America's first, and again, first National Health Lottery, a new book on health insurance. And I want to give out two websites before we begin because this is important. I want to make sure we get it at the beginning. It's mysimplehealthinsuranceplan.com, nationalhealthlottery.com. Welcome to the show, George. Great to have you with us.
Welcome, Stu. Thank you.
Well, I want to get right to it. I mean, you're talking about a National Health Lottery. We've talked about lotteries, the pros and cons of them. What about the system, the way it's set up, and what does this do?
Well, this actually kicks up onto the critical care end of the business. Really what would happen is that you would still buy health insurance, but the insurance companies in this situation would know exactly what their cost factors would be. So, I mean, they don't know today what you're going to cost. I mean, you can cost them $500, you can cost them $2 million. How do they judge that? And why I kept studying that was through the automobile business, that business is so rock solid. I mean, every other commercial on TV is for automobile insurance because the numbers are so good. So that's what I kept looking at. What happened was when I first got my health insurance for my company, within 10 years, it went 4 times the amount it originally was. There was just no way that I could even afford to give my workers health care insurance anymore. And I know I'm not alone. I talked to hundreds of small businessmen. So I kept saying there has to be some sort of solution to this problem. I mean, this is, you know, mathematically, I kept saying. I was trying to take all the blame out of it. I was trying to take, you know, everybody I talked to saying, it's this person's fault, that's person's fault. I really felt that the system has gotten antiquated. When they first discovered health, when they started doing health insurance in the 40s, you died. I mean, there wasn't the cures we have today. You don't have all these ways of healing us for the hearts and angioplasties. So that costs money. So we had to come up with for me, I had to come up with some sort of new funding system, you know, where the insurance companies would know exactly what their cost factors were. That would allow hundreds more small businesses to open up and be in the health insurance business. There's only 4, 5, 6 companies left doing health insurance. You don't see any commercials for health insurance. It's all about automobile insurance because it's so well, those numbers. So what I did was, in the book, I tried to get it where the insurance companies knew exactly how much their cost was going to be for you. Okay, but if you went over that amount, they still paid it, and then they were going to get reimbursed from the health lottery. Not only were they going to get that portion back, they were going to get a 10% administration fee. With that, they would pay the bills. They would know they were going to start making money on you. Okay, so if you had a pre-existing condition, if you were critically ill, they wouldn't care because, you know what, they were going to get their money back. So this was a rock-solid plan so that they knew exactly what their numbers would be and not be.
Well, if you look today, and you got enlightened from the automobile insurance business and found out, boy, you can get insured there. It's competitive. You can go where you want. You can get the best rate. We have laws here, regulations where you can't go across state lines in order to get a competitive rate with insurance. And we're finding out that the government is constraining insurance companies, clamping down on them so that they're forced to increase rates. We see businesses right now, as I indicated, laying off people, increasing health care because they can't assume the cost of it. Will this accomplish the objectives for everyone?
Absolutely. This is non-biased. There's no getting, you know, it's not where you got to make excuses for one person and not the other. This will cover everybody. It doesn't matter because they know these numbers are rock solid. that you will see hundreds of small insurance companies opening up. There's only 4, 5, 6 health insurance companies left. And if you go across state lines, all you're getting is the same company that's another subsidiary of the same company. They break themselves off into smaller branches in case something happens. They go out of business. They lose the branch instead of the tree. So really going across lines isn't going to accomplish anything, because the cost factor is too high. They're trying to do it through massive volumes of people. They're playing the odds. They're hoping that they can do the volume of people. The odds are less will be sick. That's why the government's starting to even look for going towards the teenagers and the young adults, because they know they're more healthier. They can draw more money in. This bypasses all of that. This bypasses if you are sick, if you're not sick. The money, the lottery was low, with the low numbers was doing $2 billion a week. And everybody who's looked at the book and said those were extremely conservative numbers. They were with the amount of people that live in the United States, so it was very, very low. I did want to shoot high numbers, and people start knocking the book down saying this guy's crazy. These numbers are just way too high for us to reach.
How do you go about changing the system? You say here, and these are your words, that there are at least $2 billion a week up for grabs, proof that the free enterprise system is alive and well. How do you calculate that?
It was 100 million people. Okay, there's 400 million people in the United States. I did 100 million people doing $20. That came to $2 billion a week. We were giving back $500 million a week in the lottery, and the money had to be given out every week. It could not be accumulated week after week the way that lottery system was set up in the book. So the money had to go back out. It couldn't stay there. If the first person had the 6 numbers, he would win. If nobody had the 6, whoever had the 5 would win. The numbers would go every week, building this economy back up again. So, and I wanted to do it tax-free on the lottery. But what happened was, when I first wrote the book, I had somebody email me back, and he actually be a pharmacist friend of mine. He said that's insane, they'll never do it. I said that, well, if they want to tax it, then put it towards Social Security Medicare. That's $250 million paying down, help us pay down the Medicare. So there's all checks and balances in this system that I designed there. It's based on the automobile insurance because it's so strong. It's a healthy system. You go home tonight, you go on television, watch every other commercial is going to be about automobile insurance, because that's how strong that company is. I could talk to you through this whole entire interview, and I'd still be pulling up automobile insurance companies on my computers. That's how many companies. There's thousands of automobile insurance companies. Everybody thinks there's 4 or 5. There's thousands of them because it runs so well. They know even if your car gets totaled, you know what, they're going to take that car from you. It's going to go to the auction. They're going to get money back. So that's how rock solid these numbers are. Our healthcare system is so up and down. Just last night I heard what they're going to do is just give a set amount of money to, United Healthcare is going to just give a set amount of money to the hospital for a cancer patient, and then that's what they're going to work with instead of the way they had it before. They were already starting to make cuts. They're trying to figure out what to do with this new system coming. This bypasses all of that. There would be no problem with them insuring anybody because they know that their numbers are there. If you're really sick, after that certain amount gets hit, they pay it, they're getting reimbursed, plus a 10% administration fee. So if you're really, really sick, they're going to make money back on you. They're not going to lose money.
It's interesting to note the insurance companies are one of the smallest profit corporations out. They work on a smaller percentage than others, and they're getting squeezed right now. What do you think will inevitably happen here in terms of the probability of this plan even having a chance?
Well, I need the Stu Taylors of the world to look at this. I need the Jack Welches. I need the Warren Buffetts. I need America to look at this plan. Get on there. My simple plan is you can go on my site for $2 and look at the plan. Tell me it stinks, it's terrible. You can vote on it, okay? For $4, you can read the book online. Okay, there's so many ways to look at this plan to show you what's going on with it. But I've been at this for a year by myself. I'm a little guy. I designed the plan all by myself. I spent all my money. I didn't ask for anybody's money. All I know is this system, I truly believe, will save the healthcare insurance system. I really, really feel it. So that's what I've been pushing for. That's what I know. The other system, we're going to wind up with I have doctors that come to I own an auto collision repair business, and I have a lot of doctors come into me. 5 of them already left early. They retired early. 2 sold their business. I had a retired insurance agent telling me that the company he used to work for is now buying insurance companies in Spain and getting ready to get out of the United States because of what's coming down. And everybody's sitting around with their heads in the ground, you know, not doing anything. And not that they're not doing, they don't know what to do. What do we do? To me, this is a rock-solid plan, but I can't do this on my own anymore. That's why I called you, and thankful for you that you put me on the radio and people will hear this today. But this is a really rock-solid plan. I had other plans before this, but I kept finding the faults in them, and they were bad. But this one I kept niching at and niching at.
Well, let me give out the website, nationalhealthlottery.com, mysimplehealthinsuranceplan.com. It's that simple, according to George Conley. Here is the name of the book. It's National Health Lottery, a new way to fund health insurance, paperback.
Are you tired of your job?
Thanks, George.
About your financial?
Thank you, Stu.